Hello everyone. We are waiting for a few more minutes to start our live session. In the meanwhile, you can just note down your questions. So there are some questions which are coming right now. It's good to see so many questions coming in. Yes, yes. Yes, that's good. Julie has asked one question. I will answer it accordingly, and few more questions coming in. Yes. Yes, Payal Banerjee, you have asked the right question. I will start in next 4 minutes and also answer all these three questions which have come just now. Top three questions have already been there. It's a good sign. So there are questions related to knee replacement surgery, post-care surgery, and whether it has to be done for both the knees, and what are the cons of knee replacement surgery. Everything will be answered in next 3 minutes. I will try to make this more interactive. I am making use of three languages, Marathi, Hindi, and English, so that larger audience can participate in this. It's really good sign that you people are putting your questions here, and more are interested in us this kind of a surgery. That is knee replacement. It is total knee replacement over here. So knee is actually a complex joint. So there are various queries, questions, and many a times they remain unanswered. So I would suggest you keep posting the questions over here. It's still 2 minutes remaining when we actually start this live session. Just 1 minute to start. I can see 3 participants joined over here. Few more to come. Standard time, and this is the first live session for me on YouTube Live, and this is specially focused on the knee care and knee replacement, how to prevent and make different kind of ergonomic modifications to help everyone get back to their work and become more functional. आजचा जे सेशन आहे ते बेसिकली नी रिप्लेसमेंट किंवा नी संबंधित किंवा आर्थरायटिस संबंधित विषयावर आहे. आणि याचा ऑब्जेक्टिव्ह हाच आहे की आम्ही यूट्यूब व्हिडिओज बनवल्यानंतर लोकांचे बरेच प्रश्न यायला लागले की असं असं काय करता येईल की जेणेकरून एक प्रकारचं इंटरैक्टिव सेशन करता येईल. हमें इसको और इंटरैक्टिव बनाने के लिए ये हमने लाइव सेशन रखा हुआ है, और इसकी जानकारी हमने विविध माध्यमों से लोगों तक पहुंचाई है ताकि एक इंटरेक्शन हो. ये एक शुरुआत है, इसको शुरुआत की तरह हम देखेंगे. मैं सभी को बताना चाहूँगा, मैं डॉक्टर चैतन्य मंत्री, मैं खुद ऑक्यूपेशनल थेरेपिस्ट प्रैक्टिसिंग सिंस लास्ट 20 ईयर्स से हूँ, और मैं मुंबई में बेस्ड हूँ, जहाँ पे मैंने क्लिनिकल केयर, होम केयर एंड हॉस्पिटल केयर में अलग अलग सेटअप्स पे एनजीओज के लिए एसोसिएट होके काफ़ी पेशेंट्स में फिजिकल एंड मेंटल हेल्थ कंडीशंस के लिए काम किया, जैसे कि राइटअप्स के माध्यमों से, वेबसाइट्स के माध्यमों से, यूट्यूब चैनल के माध्यमों से, ट्विटर और फेसबुक के माध्यमों से, फेसबुक पेज के माध्यमों से इन इन्फॉर्मेशन को देने की एक कोशिश जारी रखी है. ऑक्यूपेशनल थेरेपी ए ब्रांच ऑफ रिहैबिलिटेशन है जिसमें व्यक्ति के शारीरिक और मानसिक व्याधियों को ट्रीट किया जाता है. ये व्याधि बच्चा जन्म होने से सीनियर एज ग्रुप तक इसके हर लेवल पे, जहाँ पे भी शारीरिक और मानसिक लेवल पे डिफ़िकल्टीज आते हैं, तो वहाँ पे ये चीज़ें हम प्रोवाइड करती है. बेसिक ऑब्जेक्टिव क्या है? रिहैबिलिटेशन यानी कि पुनर्वसन, जिसको हम मराठी में पुनर्वसन कहते हैं या रिहैबिलिटेशन कहते हैं. इसका ऑब्जेक्टिव यही है कि हम ज़्यादा से ज़्यादा उस व्यक्ति को फंक्शनल करें. ओके, सो इस ऑक्यूपेशनल थेरेपी की शुरुआत एक ब्रीफली मैं आपको बताना चाहूँगा. इसकी पहले और दूसरे विश्व युद्ध जब भी हुआ, फर्स्ट एंड सेकेंड वर्ल्ड वॉर, उस समय इस ऑक्यूपेशनल थेरेपी की शुरुआत हुई, जिससे सोल्जर्स ऑफ द वॉर को रिहैबिलिटेट किया. फिर धीरे धीरे सिटीजन्स को अलग अलग माध्यमों से, हॉस्पिटल्स के माध्यमों से, आउटरीच सेंटर्स के माध्यमों से, ये अलग अलग देशों में अलग अलग जगहों पे इसका प्रसार और प्रचार होते गया, और फिर ये अभी आपके गली और मोहल्ले के आजू बाजू के एरियाज तक ये पहुंचा. Occupational therapy is a branch of rehabilitation which works in physical and mental health care, whereby basically the objective is to rehabilitate the person back to his life roles. These include functional training, and our aim is to see to it that person is mentally and physically fit to go back to his or her life roles. It starts from a child in NICU to an elderly in ICU, and we work in different setups in clinical, hospital care and home care, as well as with NGOs. So it is more focused onto the community. Now there are few questions which have come before the starting of the sessions. According to first question of Asal Malwani Tsau, it has mentioned knee replacement surgery नंतर केअर कशी घ्यायची. सो ये हा प्रश्न जो आहे हा नी रिप्लेसमेंट नंतर कशी केअर घ्यायची, याच्या आधी आपण नी रिप्लेसमेंट का करू याच्यावर पण आपण बोलणार. मी याला पिन करून ठेवतो की जेणेकरून ह्याला प्रायोरिटीमध्ये सांगता येईल. Zuili has asked one question where knee surgery of both the knees at the same time, what is better? Okay, so that will be answered accordingly. And there is a Payal Banerjee who had asked one question: what are the cons of knee replacement surgery? So good that Payal Banerjee, Gautam Banerjee, Juili Mantri and Asal Malwani Tsau has joined over here. It feels good that you people are asking lots of questions. So let us know what is the composition of knee. नी का जो कंपोजिशन है यानी कि नी का स्ट्रक्चर है वो कैसे बनता है। नी का स्ट्रक्चर ये एक ऐसा स्ट्रक्चर है जिसमें हमारे शरीर का वजन वो ले पाए, इसके लिए वो नेचर ने हमें दिया हुआ है। हमें दो नीज़ होते हैं, यानी इसकी वजह से हमारा वज़न ये दोनों नीज़ के ऊपर इक्वली डिस्ट्रीब्यूट होता है और उसके बाद वो वज़न आपके एड़ी की तरफ चला जाता है। तो बेसिकली नी सर्जरी ये तभी कंसेप्ट आता है जब ही हमारे नीज़ इरोड हो जाते हैं या डिस्टर्ब्ड हो जाते हैं। तो ये कैसे होते हैं? प्राइमरीली कॉज इसका ओस्टियोआर्थराइटिस, यानी कि देयर इज द प्राइमरी कॉज ऑफ दिस कंडीशन इज ओस्टियोआर्थराइटिस ऑफ द नीज, दैट इज इरोजन ऑफ द कार्टिलेज विच स्टार्ट्स एंड स्लोली वो इरोजन होने की वजह से दोनों एजेस ऑफ नी नज़दीक आ जाते हैं। वो नज़दीक आने की वजह से वहाँ पे जो घर्षण होता है किंवा तिकडे जे एक प्रकारे घर्षण होतं, इस उसके वजह से वहाँ पे स्वेलिंग, इट कॉजेज स्वेलिंग एज वेल एज स्टिफनेस। ओके, तो ये स्वेलिंग स्टिफनेस किंवा हे स्वेलिंग आणि स्टिफनेस आल्यामुळे तिकडे लोकलाइज इन्फ्लमेशन किंवा स्वेलिंग आणि तिकडे लोकलाइज स्टिफनेस डेव्हलप झाल्यामुळे नीची मूवमेंट ही रिस्ट्रिक्ट होते, क्योंकि नी का मूवमेंट वहाँ पे कम हो जाता है काफ़ी हद तक। तो ये जो नी का मूवमेंट कम होता है, इसके वजह से काफ़ी बार पेशेंट्स को पेन होता है, चढ़ना उतरना डिफ़िकल्ट हो जाता है। पैर का एक्टिविटी कम होने की वजह से ऑटोमेटिकली सीढ़ी चढ़ना उतरना डिफ़िकल्ट होता है, फंक्शनल कैपेसिटी कम हो जाती है और उसके वजह से वो काफ़ी चीज़ों को अवॉइड करना शुरू करता है। जैसे कि कहीं पैर में दर्द है तो मैं बाहर क्यों जाऊँ, या बाहर जाने में दिक्कत होती है। सो ये दीज आर ऑल थिंग्स विच स्टार्ट्स हैपनिंग। सो सबसे महत्वपूर्ण चीज़ यही है कि हमें इस नी को रिस्टोर करना बहुत ज़रूरी है। तो हम रिस्टोर कैसे करें? तो देर आर थ्री मेन काइंड्स ऑफ कंजर्वेटिव लाइन ऑफ ट्रीटमेंट। पहली ट्रीटमेंट है कि मेडिसिन के माध्यम से आप पेन किलर्स दीजिए, दवाई दीजिए ताकि वो पेन को कम करे। पर क्या इन दवाई प्रोवाइड करने के बाद हमारा मेन कॉज चला जाता है? तो नहीं। मेन कॉज क्यों नहीं चला जाता है? क्योंकि ये जो पेन किलर्स है वो पेन को रेड्यूस करते हैं, ना कि पूरी से आपको कुछ समय के लिए 72 घंटों के लिए या 72 आवर्स के लिए किंवा 72 तासांसाठी ते वो पेन को रेड्यूस कर सकता है या किंवा त्याला कंट्रोलमध्ये ठेवू शकतो। पण पेन किलर्स ये इज़ नॉट द ओनली सोल्यूशन, इट्स अ टेम्पररी सोल्यूशन। ऐसा नहीं है कि पेन किलर से पेन से निजात नहीं पा सकते, पर उसको एक टेम्पररी सोल्यूशन की तरह हम देख सकते हैं। फिर सेकेंड लाइन ऑफ ट्रीटमेंट क्या है? तो सेकेंड लाइन ऑफ ट्रीटमेंट फिजिकल रिहैबिलिटेशन, ऑक्यूपेशनल थेरेपी या फिजियोथेरेपी के माध्यम से की जाती है। तो इसमें क्या होता है, जॉइंट की जहाँ पे स्वेलिंग है उस स्वेलिंग और पेन को फिजिकल एजेंट मोडालिटीज़ के माध्यम से और विच वी कॉल पेन रिलीफ मोडालिटी, उस फिजिकल एजेंट मोडालिटीज़ के माध्यम से जिसमें अल्ट्रासाउंड, टेंस या कोल्ड पैक्स के माध्यम से उसको रिड्यूस किया जा सकता है और साथ में मोबिलिटी को इनिशिएट किया जाता है। ऑफ कोर्स ये सब करते समय हम डिटेल असेसमेंट ज़रूर करेंगे, जैसे एक्सरेज है, एमआरआईज है या क्लिनिकल एग्जामिनेशन है, वो हम ज़रूर करेंगे, पर वो करते करते ये सब ट्रीटमेंट्स प्रोवाइड की जाती है। तीसरा एक माध्यम ये है कि हम अलग अलग इंजेक्शंस के माध्यम से, जैसे कि कॉर्टिकोस्टेरॉइड्स के माध्यम से पेन से निजात पा सकते हैं। आप कॉर्टिकोस्टेरॉइड का इंजेक्शन अगर कोई ले तो पेन से 6 महीने तक आपको कम लगेगा, पर जैसे जैसे उसका इफेक्ट कम होगा वो आपको वापस तकलीफ देगा। तो इस प्रकार अगर आप कॉर्टिकोस्टेरॉइड, पेन किलर्स या फिजियो के माध्यम से कंजर्वेटिव लाइन ऑफ ट्रीटमेंट के माध्यम से आप उससे निजात पा सकते हैं। वी कैन मेक यूज ऑफ कंजर्वेटिव लाइन ऑफ ट्रीटमेंट लाइक पेन किलर्स, physical rehabilitation, occupational therapy or physiotherapy to and as well as use of corticosteroid injections to help reduce the pain. आपल्याला पेन कमी करायला कॉर्टिकोस्टेरॉइड्स, पेन किलर्स किंवा फिजिओथेरपी, ऑक्युपेशनल थेरपी किंवा फिजिकल रिहॅबिलिटेशनच्या माध्यमातून ट्रीटमेंट देऊ शकतो। आता आपला ऑब्जेक्टिव्ह इकडे आहे। आता अस्सल मालवणीचं यांनी एक प्रश्न विचारला की नी रिप्लेसमेंट सर्जरी नंतर केअर कशी घ्यायची? सर्वात पहिल्यांदा आपल्याला लक्षात घ्यायचं आहे की नी रिप्लेसमेंट सर्जरी का करावी लागते। आता बऱ्याच जणांना असा प्रश्न असतो की नी रिप्लेसमेंट सर्जरी करावी, दोन्ही पायांची करावी, एका पायाची करावी, करावी की न करावी, कधी करावी, कोणत्या ग्रेडला नी असेल तर करावी। तर हा एक कॉमनली प्रश्न आहे। त्याच्यासाठी एक स्ट्रिक्ट गाईडलाईन्स आहे. त्याचा व्हिडिओ आता नेक्स्ट याच्यामध्ये मी रिलीज करणार आहे. पण तरी एक ब्रीफ ओव्हरव्ह्यू तुम्हाला देतो. नी रिप्लेसमेंट करताना पहिली गोष्ट पाहायची की तुम्हाला पेन किती आहे. ओके, तुम्हाला पेन किती आहे, तुम्हाला तुमचा एक्सरे काय सांगतोय, तुमचा MRI काय दाखवतोय आणि तुमची फंक्शनल ॲबिलिटी किती आहे. फॉर एक्झाम्पल, जर तुमचा एक्सरे खराब असेल, बरा नसेल, की एकदम त्याचा ग्रेड 4 दाखवत असेल, पण तुम्ही फंक्शनली सगळं करत असाल किंवा तुमच्या ॲक्टिव्हिटी लेवल ह्या कमी असतील, तर तो कॉल कधी घ्यायचा हा पेशंट आणि ऑर्थोपॅडिक सर्जन त्यांच्या त्या क्षणाच्या असेसमेंटवर ठरवतो. मे बी एखादा तुम्हाला ऑर्थोपॅडिक सर्जन सांगेल की तुम्हाला आता नी पेन आहे, लगेच नी रिप्लेसमेंट करून घ्या. तर ते तसं नाही आहे. नी रिप्लेसमेंट करून घ्यायच्या आधी पहिलं तुम्हाला डिटेल असेसमेंट पहिलं पाहिजे. पहिलं असेसमेंट आपण स्वतः करायचं की माझं दिवसभराची ॲक्टिव्हिटी किती होते, मी ॲक्टिव्हिटीमध्ये माझ्या उभं राहणं जास्त आहे का, खूप चालणं जास्त माझं होतं का, किंवा मला खूप ट्रेनने किंवा बसने प्रवास करावा लागतो का. तर मला नी रिप्लेसमेंट हे कमीत कमी मिनिमम एज 60मध्ये करून घेतलं तर मला पुढे 30 वर्ष त्या नीला काही डिफिकल्टी येणार नाही. म्हणजे मला प्रायोरिटीमध्ये काय करायला पाहिजे की माझं एज असेसमेंट, माझं वेट किती आहे. ओके, वेट जर जास्त असेल तर का आपण वेट मॅनेजमेंट मेथड्स वापरू शकतो का, त्याच्यामध्ये डाएट प्लॅन करू शकतो किंवा एक्सरसाइजच्या माध्यमातून वेट रिड्यूस करू शकतो की जेणेकरून आपल्याला या डिफिकल्टीतून बऱ्यापैकी एक प्रकारे बाहेर पडता येऊ शकतं. सो वेट मॅनेजमेंट इज अन इम्पॉर्टंट पार्ट वेअर बाय the knee pain can be reduced to a certain extent. So first, before deciding whether to go for a knee surgery or not, it is very essential to understand whether this is the appropriate time to get it done. Then the second important question which Julie has asked is it okay to a knee surgery for both the knees at the same time? What is better? I would prefer to first get detailed assessment about both the knees. Okay, for example, if the left knee is more damaged compared to right, first get left operated. Okay, and at the same time, in the meanwhile, prepare your right knee for the future operation if required. Okay, the main objective should be to restore structurally the knee joint. So if your left knee is more affected, or vice versa, if the right knee is more affected, the more affected knee should get operated first. Okay, as per the guidelines, this knee replacement surgery has to be used as an adjunctive treatment method. It should not be given in the priority. First, check whether the more affected limb can be treated in a conservative line. Say, for example, use of a painkiller or physical rehabilitation. Is it still getting worsened? Is it getting still eroded? Whether your X-ray suggests that your knee is very much damaged, the cartilage is also affected, or is there any kind of a meniscal tear or any other issue related to ligaments and it's not more of about the erosion. We have to assess it in that fashion. So first we have to understand exactly what is the quality of the knee. Say, for example, if the knee is eroded but still you are able to do your functional activities, then you should try to maintain those functional activities as much as possible so that your ability and overall capacity and confidence is maintained. Your regular exercises might definitely, like quadriceps strengthening, hamstring strengthening, strengthening your hip muscles, calf muscles. These are also important during the pre-operative training. So as per the Julie's question, is it okay to get a knee surgeries done? For both the knees, I would suggest first get a detailed evaluation whether which knee is affected more, and accordingly decide to go for a first limb at a time. And after minimum period of 3 months, because a post knee replacement, that particular joint takes 3 months of time to completely get healed. You might start walking, stair climbing, going out, or going for travel or vacation. But at the same time, you have to take extra precautions during those 3 months of the post surgery. Then the most important question asked by Asal Malwani is high knee replacement surgery नंतर केअर कशी घ्यायची. ओके, सो नी रिप्लेसमेंट सर्जरी तुम्ही जेव्हा करता तर त्यावेळी त्याच्या आधी तुम्हाला एक प्लॅनिंग करावं लागतं. ते म्हणजे प्री ऑपरेटिव्ह एक्सरसाइजेस. त्याच्या प्री ऑपरेटिव्ह एक्सरसाइजमध्ये तुम्हाला काय करावं लागतं, तर पहिलं तुम्हाला तुमचे नीला स्ट्रेंथन करायला लागतं. बऱ्याच वेळा आपण नी रिप्लेसमेंट प्लॅन करतो पण त्याच्या आधी तुमचा नी प्रिपेअर्ड आहे का, तुमचे क्वाड्रिसेप्स स्ट्रॉंग आहेत का, तुमचे हॅमस्ट्रिंग मसल विथस्टँड करू शकतील का. कारण जेव्हा तुम्ही नी सर्जरी करता तेव्हा लिटरली त्याला एक 6 इंचाचा स्कार होतो. ओके, ऑपरेट करताना तर 6 इंचाचा कट देऊन तो सर्जन आत जाऊन तिकडे बऱ्यापैकी तो रिप्लेसमेंट करणारा पार्ट बसवतो. मग अशा वेळी तुम्ही जेव्हा तो जो पार्ट कट करतात, मसल्स सगळे सेपरेट करून तो सर्जन आत जातो, तर काही तंतू मसलचे हे कट होतात. आता ते जेव्हा तंतू कट होतात तेव्हा ऑटोमॅटिकली परत त्याला ती स्ट्रेंथ रिगेन करणं हे डिफिकल्ट असतं. म्हणजे 0पासून तुम्हाला परत 5पर्यंत यायला पाहिजे. आज तुमची भलेही नी तुमचा अफेक्टेड असेल, पण त्याची एक ग्रेड 3, ग्रेड 4 किंवा ग्रेड 5 त्याची स्ट्रेंथ असू शकते. ती नी रिप्लेसमेंट सर्जरीच्या इनिशियली पहिल्या 2 दिवसामध्ये किंवा काही आठवड्यामध्ये ती कट केल्यामुळे त्याची स्ट्रेंथ कमी होते. मग त्याला प्रिपेअर करण्यासाठी आधी तुम्हाला प्री ऑपरेटिव्ह स्ट्रेंथनिंग करणं खूप गरजेचं असतं आणि त्याच्यानंतर सर्जरीनंतर ही केअर सगळ्या लेवलला घ्यावी लागते. आता पहिली केअर काय घ्यायला लागणार, तुम्ही बेडमधून उठताना, बसताना कसं येता, तुम्हाला हेल्प करणारे अटेंडंट्स किंवा तुमचे फॅमिली मेंबर्स जवळपास आहेत का. कारण बऱ्याच वेळा नी रिप्लेसमेंट झाल्यानंतर तुमचा पाय उचलून जमिनीवर ठेवावा लागतो. ओके, तुम्ही करू शकता, तुमच्या ताकद आली असेल, रिगेन केली असेल, पण एक केअर घ्यायला, कारण त्याला टाके असतात किंवा त्याला स्वेलिंग आलेलं असतं, त्याचं वेट थोडंसं हेवी झालेलं असतं नॉर्मल लिम्बपेक्षा स्वेलिंगमुळे, तर त्याला केअर घ्यावी लागते. रात्री उठताना, बसताना बऱ्याच वेळा ह्या काही प्रिकॉशन्स घ्याव्या लागतात. किंवा तुम्ही रात्रीच्या वेळी समजा बाथरूममध्ये गेलात तर तिकडे नॉन स्किड मॅट्स आहेत का किंवा कुठे स्लिपरी फ्लोअर नाही आहे, ही केअर घ्यावी लागते. तुमचा बेड हा साधारण 18 ते 22 इंचाच्या हाईटवर असावा. मेनी अ टाईम्स असं होतं की अर्गोनॉमिकली बेड असणं आवश्यक असतं. काय असतं बऱ्याच वेळा की तुम्ही जर जेवढा लोअर सरफेसवर झोपाल किंवा बसाल तेव्हा उठताना तुमच्या गुडघ्यावर प्रेशर जास्त येऊ शकतं. ते येऊ नये पोस्ट ऑपरेटिव्ह केअरनंतर. म्हणून साधारण तुम्ही ऑपरेशनला जायच्या आधी तुमच्या घरातले बेड हा साधारण 18 ते 22 आहे का. मग जर नसेल तर त्याला बेडच्या खाली तुम्ही रेझर्स लावू शकतात किंवा तुम्ही वुडन रेझर करून त्याची हाईट ही आधीच 18 ते 22 करू शकतात की त्याच्यावर एक्स्ट्रा गाद्या टाकून त्याची हाईट 18 ते 22 करून एक 18 ते 22च्या लेवलला ते आणू शकता. त्याच्या व्यतिरिक्त तुम्हाला टॉयलेट सीट्स किंवा इंडियन टॉयलेटच्या ऐवजी कमोड सिस्टम किंवा कटआउट चेअर्स तुम्ही यूज करू शकता. कारण तुम्हाला आता खाली बसता येणार नाही, त्यामुळे तुम्हाला तुमची जो कमोड असेल, तो आजकाल बऱ्याच वेळा असं होतं की हॉटेल्समध्ये किंवा नवीन कमोड्स हे 14 ते 15 इंचाचे असतात जमिनीपासून हाईटमध्ये. मग ते तुम्हाला ॲडजस्ट करायला पाहिजे. त्याच्यावर रेझर्स येतात आजकाल. जर तुमचा कमोड समजा लोअर सरफेसवर असेल तर तुम्ही रेझर लावू शकता की जेणेकरून त्याची हाईट 18 ते 22मध्ये राहील. आणि तुम्ही वॉकर जेव्हा न्याल पोस्ट ऑपरेटिव्ह नंतर तुमच्या टॉयलेट्समध्ये, तर तो वॉकर जाण्यासाठी जागा व्यवस्थित पाहिजे. आजूबाजूला अडचण असता कामा नये किंवा तुम्हाला बसताना उठताना साईडला ग्रॅब बार्स असले पाहिजेत की जेणेकरून तुम्हाला उठताना इझी होईल. So toilet modification is a essential thing or ergonomic thing which is very much necessary post operative, because many a times what happens ki you are taking different kind of medications and other things, you are taking antibiotics, so many a times a patient need to go to the washroom. So at times this kind of modification has to be done pre-operatively, so that to save time and to prevent different kind of problems post operative. So the next question I am taking is of Payal Banerjee. What are the cons of knee replacement surgery? Payal Banerjee, I would like to tell you there are no cons of knee replacement surgery, but as such, knee replacement surgery is, I think, it is the best lifestyle surgery. I would consider it a lifestyle surgery more as a curative instead of a curative option, because knee replacement surgery gives you an additional life of 30 years. Nowadays 30 years, previously it was 15 to 20 years, but now it gives you a total life of 30 years. So if you get operated at the age of 60 years, say for example, so your knee can sustain the pressure till 90 years of your age. And that doesn't mean that after 90 years your knee you have to get again a revision surgery or something. After 90 years you can continue with the joint unless and until there is any kind of a mechanical problem within the knee joint. But this knee can sustain the entire 30 years of your productive life. And many times after 60s there's something called retirement, and everyone wants to move around, go everywhere, and at the same time you are having the knee pain. So I think this knee replacement surgery is the best option, and it doesn't have cons, but you have to take precautions. Say for example, you should use non-skid mats in the bathrooms or washrooms, so that you avoid any kind of fall or something like that. In the kitchen, you have to make an arrangement whereby you don't need to stand too much. Okay, knee replacement definitely gives you a proper structure of the knee, but that doesn't mean you have to overburden your knee. At the same time, weight regulation is also essential, because weight management has to be there. So even if knee replacement has been done, that doesn't mean you get a freedom to stop doing weight management program. Weight management definitely help the knee replacement program as well in the future. And cons, you have to take a lot of precautions, I would suggest. Precaution like avoid prolonged standing, avoid sitting on a lower surface, avoid cross leg sitting. These are important precautions. For first 6 months, avoid sleeping on the side which has got affected or operated. If your left limb has got operated for knee replacement, then avoid resting on the left limb in that position. Instead, you can rest on the right side with a pillow in between the knees, or you can lie on your back. Okay, and after 6 months, you can lie on the operated limb, so that until that entire duration, the knee will get healed. So, any more questions? Hi, Gautam ji. So Gautam Banerjee has asked one question: all obese people are more risk of knee injury, and do any special precaution for patient with history of diabetes and high blood pressure? Okay, so Gautam ji, this is an important question which you asked. Obesity and knee issue is linked together. Okay, so if my weight is not in accord to the height and weight guidelines which have been given, and it is slightly more, or I am on the obese side or higher weight side, the primary thing what will happen, your every extra kilo of weight, okay, will start helping the erosion process. Okay, so your 1 kg of extra weight will be distributed into two, like half kg on the left and half kg on the right. So that extra, it is like tying a weighted cuff on your limbs and walking. So this extra weight is going to pull the proximal part of the joint to the lower portion, and if it keeps on happening every time, there will be an erosion. So if, for say for example, half a kg weight has increased, so that extra half kg will lead to erosion on the lower portion. And if, say for example, in case of obesity, where 10 to 15, 20 kg weight is more than their required weight, then it's a grave problem. It's a very serious problem, and it needs to be administered. Primarily, I would suggest in that case, weight management apps are different apps are there, where you can actually go through your current weight, your height, and the dietary program. I would suggest there's one MyFitnessPal app which I normally use it, and it is available for Android as well as Apple devices. And you can put in that MyFitnessPal, you can put your height, weight, your activity level, and you can track those things. At the same time, there's a Indian dietary plan which is available over there. I have seen, say for example, if a person wants to have some kind of a snack, so it mentions how much calories are there in that snack, how much carbohydrates, minerals, or protein will be there, and accordingly you can plan your entire diet plan. So dietary modification is the essential first step. At the same time, exercises, like there is no replacement for exercise. Exercise is essential, like the way we breathe, like the way we have food, we sleep. Similarly, we have to give our most important time to exercise. The more you exercise on your joints, the more flexible they are, the more they are flexible, the better it will function. And if they are functioning better, your quality of life will improve, and your life expectancy will also improve. So obesity has direct link. I have put a video on that also. You can go through that, and if you like it, you can comment on that, and you can share it to your friends who require the assistance. And I think obesity is nowadays more of a lifestyle related. Many people don't get time to do exercise. Many people complain that they don't get a time, appropriate time to get it. Many times they go very early, they come very late. So I can also understand they don't get time. But whenever you get some time, even in any kind of a holiday or vacation or Saturday, Sundays, if you have an off, please do a little bit of exercise. You can start with a simple warm up, go for cycling, swimming is also a good exercise, and that will help further. And if that is also not possible, a proper diet management is essential. We can reduce the we can have small amount of meals in a day instead of having a big meal, so that will definitely help to prevent any kind of obesity related issues for the knee. And yes, it's a high risk. So Payal Banerjee asked one more question. Hi doctor, can you please elaborate more on poor knee? Does younger people with hectic lifestyles suffer from the same? And precautionary measure one should take to avoid such condition? Yes, it's a nice question, Payal. As you have mentioned about the lifestyle, yes, younger generation has to go through many things. It starts not just from the office work, but prior to that, when you are in a college or school level, where the demand time limitation is there, you have to sit and study. So this kind of sedentary lifestyle at times affect many things. It affects hormonal issues. It creates many kind of stress hormones. Hormonal issues are there. At the same time, weight increases, exercise time is reduced, your walking time is also reduced. Many times we, instead of walking, we take auto rickshaw, taxi, and all those things, and your time duration for exercise and walking is reduced, and that adversely affects your knee problem. So yes, lifestyle problems are there. Say for example, instead of having a home food, you may be consuming outdoor food, or say for example, for food from the hotels, which are not that good in calories at times, and that actually affects your overall pattern of life. At the same time, sedentary lifestyle, sitting for longer hours, activities which are less like physical activities, overall will hamper the quality of living. So you need to have a proper walking routine. I would suggest 10,000 steps per day. That's enough. You can do in this way. If you're going for office, if your office is a 5 minutes walking distance, why not walk instead of taking a cab? Okay. Or if you can go for a morning walk, that's pretty better. Or if you reach early someday, if you reach early at home, why not go for a walk after having a dinner? So this kind of thing will definitely help you. You can have a cycle at home, like a stationary cycle you can make use of, and or a treadmill can help you. So in case you don't have a time throughout the day, and at the end of the day, or just before starting the day, if you start with positively with a physical activity, it will definitely help you out. So Gautam ji has asked one more question. Any special precaution patient with history of diabetes and high blood pressure? Yes, of course. Patients with before going to knee replacement surgeries, diabetes has to be in control. If you are on medications or if you are on insulin, these things has to be monitored properly. You need to talk with your diabetologist before getting this kind of a surgeries, because it's finally, even if it's done with a lot of care, still these kind of things need to be addressed beforehand. So many a times before going to surgeries, your surgeon will give a list of things to do. He will tell you to get some kind of blood test, x-rays, regular x-rays, MRI if required, if he finds any kind of ligament or meniscal issue, prior issues with that, or get all your diabetes and blood pressure. Even they ask for 2D echo and ECG prior to going for your test. And once they get a okay from the diabetologist or your practitioners or your MD physician, then only they go for an operation. Even if it is planned, and if it is your diabetes or blood pressure is not in control, they never go for this kind of operations. If you have on ecosprin or any other tablets which will help in regulating the blood pressure to a certain extent, so before going to operation, these things has to be regulated, because post-operative there or during the operation, normally there is no blood loss, but if any kind of blood loss or something happens, so it might adversely affect physiologically. So that need to be taken care of. And she has said, thank you, doctor, for answering my question. However, I do have another query. Okay, Payal ji. What's the recovery timeline? Do a patient with multiple sclerosis take longer time for recovery? Yes, absolutely. Multiple sclerosis is a condition. I would like to tell you. We have put a lot of videos on multiple sclerosis in our video section. Please go through that. But multiple sclerosis is related to neurological condition whereby their myelin sheet is affected. Okay, that doesn't mean ki the patient might take a longer time. It depends patient to patient. The more you, if a person is having multiple sclerosis and the person goes through a proper aggressive pre-operative sessions for knee replacement, knee exercise or rehabilitation, it will definitely help the patient in the long run or after knee replacement. And I don't think a patient with multiple sclerosis will have a problem during the recovery from the knee replacement surgery, because many a times what happens, people have a misconception. If I am having a history of stroke, if I am a history of multiple sclerosis, if I am having diabetes, so I would take a longer time to recover. It's not like that. Everything should be controlled. So when you are going, if you are need to go for knee replacement surgery or any kind of surgery related to knee, so if you are having a history of multiple sclerosis, that thing can be tackled by a neurologist. And once the neurologist give you a certification that now you can go for a knee replacement surgery, normally they give a certification or okay from their side. And after that, you go for a knee replacement surgery, then you can definitely you can definitely take the same amount of time as other patients will take. Ideally speaking, if I get a surgery done today morning, it's so effective if you do a proper rehabilitation. If I get a surgery done in today morning, by end of the day, I will be made to do the bedside mobilization like ankle exercise, knee quadriceps strengthening, static exercises, knee flexion, slowly around 30 to 40 degrees, and then I will be made to sit on the edge of the bed. And if possible, if the person is very confident enough, the same day the person is made to stand. So if the surgery is done, say for example morning 8 a.m., so the person can be made to stand in the evening at 4 p.m. or 5 p.m. Okay, so it's that effective. The next day the patient can be made to walk out from the bed to say for a corridor within the hospital. And if the patient is confident enough, if everything is fine, and then the same day or the next day we can start with a 6 to 7 steps of stair climbing, that is around a half a floor. So this kind of recovery, if it is maintained even with a patient with multiple sclerosis, this rehabilitation will be very much effective. Finally, I will like to tell you that multiple sclerosis would not be a hurdle in this entire process of knee replacement. But if it is tackled properly, if everything goes fine, so the recovery of patient with multiple sclerosis and with a history of knee osteoarthritis can be tackled in the same way as the other patients. So I think your query related to the same has been answered. So Asal Malvanitsav has asked one more question: what to follow after the surgery? Surgery diet. She wants to ask you what to follow after surgery diet. Yes, this after surgery you need to have a appropriate diet. Yes, appropriate diet. This means a good protein diet rich in protein like fish. If you are having a non-vegetarian diet, you can go for fish, chicken, mutton, or if nothing is possible, boiled egg can help. Boiled egg has a good calcium level, so you can have a boiled egg in your diet. You can have milk products if you are good with the milk products, or if you don't have any kind of lactose related issues, so you can go for milk products also like curd, dahi, which we normally call, and that also can help you. So diet is very essential. I would suggest you get a proper diet chart from your hospital itself and ask them to get a diet, long-term and short-term diet plans, which will help you further. Because initially there are lots of medications, painkillers, and antibiotics which are given, because of which a person doesn't want to have a regular diet. So you can start with the soups like chicken soup or tomato soups or different kind of soups, and slowly, gradually, you can move to a more solid diet once you are able to have it. Any more questions? So a good amount of questions have come. Julie Mantri, when is it okay to drive a car, especially after right knee surgery? Okay, so if your surgery is done, for example, today morning, if you had done the surgery, it takes 15 days to get your sutures removed. Okay, so if today is the first date of the month or first day of your surgery, so exactly 15 days after the surgery, your sutures will be removed. So during that entire 15 days, you can strengthen your knee joint to a certain extent, whereby you will be able to walk initially with a walker, then with the cane, and then independent walking. So once this level is achieved, slowly in between, you can at the same time you can continue with the stair climbing, say for example 7 to 8 steps, then around 20 steps, that is one floor, and that way you can increase your functional ability. When you need to drive a car, you need to assess the different kind of cars. Nowadays they are automatic cars, so you don't have to press the clutch part of the car for a longer time, because if you want to change a gear, many times in old cars, you need to press the clutch with the left, and at the same time put the gear. In automatic cars, this kind of problem is eliminated. And in that case, basically what happens, so you need to just focus on the accelerator part. Now the accelerator part is on the right side, as per your question. You asked for after right knee surgery. I assume that you mean to say right knee surgery. Okay, so if the right knee is has gone for a knee replacement surgery, even if your car is an automatic car, so it will have to put pressure on the accelerator, so that coordination has to be done effectively. So I would suggest, if 15 days post-operative your sutures are removed, if everything goes fine, a period from 30 days to 45 days would be a brief period whereby you can go independently walking without stick, or without a cane. And in that 30, from the 30th day to 45 days, in that entire duration, you can start driving a car in your first year compound, your society, and if possible, with around a distance of 5 kilometers or 10 kilometers, at a time when it is not crowded. If you're confident enough, then you can definitely go still further, maybe 10 kilometers from there, and accordingly you can slowly increase the duration. I would suggest initially 30 days to 45 days of waiting of the timing. You have to need to first go through the entire thing within your locality to make it more effective. But around 30 days, if your proper management is being there, and proper execution of this rehabilitation program is done, definitely you will be able to drive your car for around 5 to 10 kilometers approximately, in a time duration from 30 to 40 days. So it's a nice question. What are the recommended sleeping position after knee surgery? Yeah, Julie Mantri has asked one more question, and that is related to positioning. Okay, that is very essential. It starts from the hospital itself, and many a time positioning is very important. So say for example, today you have got a knee replacement surgery. So how will you position your knee? Initially, it has to be placed when you are lying on a supine position, or you are lying on the back. Your knee should be positioned in a straight line with a pillows, 2 to 3 pillows below your knee, so that your limb remains elevated at a heart level. Why heart level? If your limb is elevated, the swelling after the knee surgery would be reduced. It will be pumped out because of the elevation, and because your limb is elevated, and if you keep that for a longer duration, the swelling reduction will be faster, and you'll be able to move the limb perfectly fine. Now the question comes, how to lie down, whether to lie down on the same side, or on the non-affected or non-operated side. I would suggest change in position after every 1 hour. So if you're lying on the back for 1 hour with the pillows below your knee, and with the proper elevation and proper positioning, you can lie down on the non-operated side. Say for example, if your left knee is operated, you can lie down on the right side of your body with a pillow in between your knees. Okay, this is to prevent any kind of knee to knee contact, because if you lie down on the operated side, the weight of the non-operated side knee might come on the operated side, and that might not damage as such, but that might create a pressure on the swelling part of the operated knee. So you should never lie on the operated side for at least a duration of 6 months. Okay, I normally suggest key guidelines of around avoid for 2 to 3 months more, that is around 6 months. Average, you can say for example 4 to 5 months. You should not lie down on that side, and preferably it will go for a 6 months duration. And the recommended position, I would say, you need to change after every 1 hour. So if say for example, if you're lying on the back for 1 hour, change it on the non-operated side for 1 hour. So this will help in preventing any kind of bed sores development on your head, back of your body, or the lumbar region, or the heel region, or those portion which come into contact with the bed. Because many a time patients face, or elderlies face, this kind of difficulties like bed sores post-operative, because they don't move at all. Many a times the limb is not properly lifted. At times you need assistance from your attendants or relatives many a times during this entire post-operative care. I did justice to the question of Julie, and there are many questions coming. Yeah, any special precautions? Yeah, I answered that. What are the so Gautam has asked one question. What are the patient attendees guidelines? Okay, can, and one more question he has asked: can one start skipping, running, or do heavy weight exercise post the replacement surgery? Also, can one lift heavy weights post surgery? Okay, so initially I go to the first question. Is important. What are the patient attending guidelines? Uh, Family members are the core of this entire knee replacement project. I would say the work of the family members or the attendees, or those help you in the entire process. It starts from the day one when you decide of having a knee replacement. It starts when it's, yes, of course, family has to support by many things, like say for example care after knee replacement, pre-operative, different kind of test has to be done. So the family members initially, first I will give them a list to do in the for pre-operative, during the operation, and after operation. First, family members has to be maintain a high level of confidence. Okay, if you are confident enough, then only the patient will be at ease. See, when you go for a knee replacement surgery, it's sounds easy that it has the person has gotten, but the person who bears the entire thing, entire pain of knee replacement, they have to go through many things. There's a kind of psychological pressure, emotional issues are whether it will work out or not, and so many things are there. So initially, you have to prepare yourself so that you can support your family members during the entire process. And the family members has to be alert in whatever changes which are happening in the patients in emotional level, and you need to be very cooperative, supportive towards your family members. At the same time, you have to see to it that all the a list of things which your surgeon has given, like different kind of blood tests, x-rays, MRIs, and what all not things have done on a particular time. Have you visited the hospital on proper time to get your policies, mediclaim policies, and other things done on time? Admission timings, whether it is done on time. Any kind of you need any kind of a blood bank support, then you need to maintain that. If any kind of difficulty arise, whom need to be contact, what need to be done, that has to be, you need to have a coordination with your surgeon regularly. Any kind of a dietary modification pre-operative, any kind of a changes which need to be done, any kind of physical rehabilitation, everything needs to, you have to take a look on during the day of operation. First thing I would like to tell, be extremely confident. Knee replacement is a very nice lifestyle surgery, so you don't need to worry about anything. You just need to be calm and quiet and do your work, and just let the everything fall in place. All the surgeons who are doing the knee replacement surgery are very well trained enough to do these things, so you don't need to be worry about anything. You just need to be calm and quiet. And after the knee replacement surgery happens, your roles will improve. It will be more, I think. Many a times what happens, some of your family members roles, say for example, if your mother has got operated, or family member has got operated for knee replacement, if the person is doing cooking work, say for example, so someone from the family or some kind of house help that need to be taken throughout the entire 1.5 month of period, and whereby you need to maintain your patience level as well, because everything will not be that smooth as you think. So many times it happens that initially everything was very smooth, suddenly knee replacement happened, and after once you bring the patient at home, then it becomes very difficult to manage the patient. Then there may be different kind of clashes which may happen at home, any kind of tussles may be there. So there may be any exchange of different kind of words, anger, and so many things. So you need to first prepare yourself for that. You need to understand this is a project. Knee replacement is not just a regular surgery. It's a major surgery, and it's yes, if it's done by very skilled surgeon, but still you need to maintain your cool. At the same time, you need to look after the patient's health. You have to see to it that exercise is done properly, switches are removed on time. Mostly that is done between 15th or 20th day, or post-operatively it has to be done on time. The way the person sits, get up from the bed, the way they go to toilets, many times they need to go to toilet at late at night, midnight, something like that. So you need to have take extra care. May make a arrangement whereby the person can ring a bell or call you, and you get alert, and you can go take the patient to the washroom at night, because many times patient is in their sleeping phase, and there might be a history of fall and any kind of accidents within the home. So you need to look out for that. So these kind of care arrangement has to be done. Suture removal, after suture removal you need to have a follow-up with the practitioner. Normally it happens for 1 month after suture removal or 6 months after suture removals. So you need to take that care, regular follow-ups. If any kind of medications have been stopped during the pre-operative state, you need to look after those medication, whether to start it again, like different kind of medication related to hypertension or something which may have been stopped during the operation. You need to consult the practitioner whether to start it again, when to stop the painkillers, when to give it, should I give it as an SOS. All these things need to be tackled. The second question is about can one start skipping, running, or do heavy weight exercise post knee replacement surgery? Also, can one lift heavy weights post surgery? Uh, yes, if you are effectively doing your exercises pre-operatively, you will have a good result during the post-operative care. And initially, when we start a post-operative rehabilitation, we start with a static exercise like static quadriceps, static hamstrings, then dynamic knee exercises. These initially are without weights, and slowly we gradually add weights like half a kg, 1 kg, 1.5 kg, 2 kg. We start that with the weight training, with regular weight training, and this slowly goes for a period of 1.5 month or 2 months. So average, if you calculate today, is if you got operated for knee surgery, so your therapy starts this once you get come out from the operation theater, you are back to the bed. So the therapy starts from that point itself. We start with ankle exercises, and slowly static and dynamic exercises, and slowly it goes to the more different kind of exercises with improved or increased number of weights, and that definitely helps after the surgery. But that doesn't mean you can make use of a heavy weight exercise immediately. Yes, slowly gradually, when you resume your work, you are out from all kind of aids like walker, use of canes or something, and you don't require any kind of assistance or any kind of support during the entire process. Gradually, as the time goes, after 2 to 3 months or four, I would suggest 4 to 6 months. After 4 to 6 months, when I have already mentioned about you can drive a car also. So after around 4 to 6 months, you can start with a regular gymming also, with extra precaution. You need to tell your trainer about your knee replacement surgery. You can start with initially with treadmill. Skipping, I would suggest wait for at least 8 to 9 months, because it is not recommended skipping. But yes, you can go for swimming. Skipping is not advisable because it's a bouncy movement. So instead of skipping, you can go for a treadmill walk or inclined treadmill. You can go for, and skipping you can postpone for at least 10 to 12 months, because it's a bouncy movement. So I think it should be avoided. And if you have done a unilateral knee replacement, say for example knee replacement has done for one side only, the other side might be damaged. So if your affected side has been operated and other side is still affected, so you need to take extra care so the other side doesn't get damaged. Of course, if your both the knees have been replaced over a period of time, so gradually you can start with skipping also after a period of 1 year. I won't say you should not start, but you can gradually start after a period of 10 months to 1 year, because still I think some level of precautions need to be taken, extra precaution. But you can definitely start with swimming. You can start with a little bit of sport jogging. So, mini squats can be initiated, and I would suggest instead of skipping, you could go for more of a strengthening kind of exercises if possible at home, and as well as gym, with extra precautions. So next question, what's the most common mistake patients do post knee replacement surgery basis on your experience. Yes, as my experience is around 20 years from now, I would suggest around 2 decades of my patient care. I have experienced many things. Initially, the financial cost is a big burden on the family members at time, and they look it at as a burden. It's not like that. Okay, you need to prepare. Once, see, you are consider that as an investment. Okay, you have to invest your mind, you invest your money, you invest your energy, you invest your dietary protocols and many things. You need to invest on your knees, because these knees are the one who have supported you for a long time. Imagine when you started walking, it was the I would say it was the first birthday when you were able to stand independently. Okay, so consider if your age is 60, so for 59 years since you are able to stand, these knees have supported you. So investing in a small amount is not a big deal. So you have to invest in all forms in the knee. So what's the common mistake patients do now? If you're looking at this as a project, you need to prepare yourself for that. The first and more first thing the patient says ki, I had done a knee surgery, but still there is a pain. So why did I do? So did this is the, I would suggest, this kind of emotional change is the most important mistake. Okay, if you are confident enough to go for a knee surgery, you have to prepare your mind and maintain the state of mind throughout and post rehabilitation as well, because it is an essential part. This is the first thing which need to be tackled. The second most important thing is while positioning your body in the bed initially, the way the patient at times they neglect different kind of position. Whenever we tell them keep a pillow below the ankle or the knee, keep it elevated, they ignore that because they think it becomes a hurdle in their sleep. Slow at times they remove that pillow. Okay, so this again affects the overall quality of the rehabilitation. The knee remains swollen. They don't exercise even if we tell. They keep constant telling about the pain post surgical. They avoid moving the knee, and that's a biggest mistake. I would suggest. At the same time, not having a proper diet, not looking after the care of the post operative scar over the knee once the sutures are removed. So this kind of a management also need to be done. Any kind of a bed sore that has to be immediately told to the physician or the operating surgeon, so that they can give any kind of medications to tackle that thing. And one more thing is, many times these kind of mistakes happen not knowingly, but sometimes unknowingly as well. Like say for example, if a practitioner has told you to do this kind of exercise, but you're ignoring it just because you feel tired. So at times I can understand it's very tiring process. Post knee replacement, it consumes a lot of energy. You feel helpless. You are very much dependent on many things for family members. But at times you have to see it as a case whereby you need to take help very very essential. You need to take any kind of aids like walker and cane. Avoid going alone in the washroom, and this kind of things you have to take care. If you take help, I would suggest for a period of 1 month you can definitely take anyone's help, any kind of attendees or helpers you can make use of, so that you don't need to make any kind of a mistake, and slowly gradually you can progress. Julie Mantri is saying, thank you for answering my question. Julie, any more questions do you have? Please let me know. Gautam Banerjee, Payal Banerjee, Asal Malvani, so you can also definitely ask me more questions. And yeah, I'm getting very good feedback here. Feedbacks are coming. Yes, absolutely. I'm very much ready to answer most of your questions. And if any more questions, please let me know. Yes, she's saying, Payal Banerjee is saying, very informative session. Thank you for the session and looking forward to more. So, yes, I'm also looking for more sessions. And I would definitely say ki, more such sessions has to be done. Awareness is essential in this hospital. Any kind of interaction is very much needed. Um, any more questions, please? It's almost 1 hour and 1 hour now from the time we started, but it's around slightly 7 minutes still we have, 7 to 8 minutes still we have, where we can, before which we can wind up. If you have any kind of other questions which you think I have not answered properly or which need to tackle. After the session, this video will be available on YouTube Live. You can go through, you can circulate it to your friends and family members. And yes, definitely, you can go through my WhatsApp number, which is already mentioned in the description of the YouTube channel. All your questions will be answered there as well. And if any kind of questions you have for different videos, you can just comment on the section, or you can go through my email address as well. And I'm very much happy that this is being the first YouTube live session. You have participated and asked so many questions on this. It took approximately around 1 hour to take care of this all questions, and I think I have done a bit of justice to all your questions. Yes. One more question has come. Can you help with exercise videos with knee replacement recovery plan, please? Yes, for sure. It's a good suggestion. I would definitely provide post-operative knee replacement exercise. These are videos are going to come. I have lined up different kind of videos as per the need. Initially, the signs and symptoms were there, which I had published. Then after that, exercises which need to be done, that has been published. Or the next question was about how knee replacement surgery when to do, and that is upcoming video. And after that, I've definitely put the knee replacement videos and a recovery plan. I will try to provide a lot of animation AI videos just to get an exact understanding about all these things, and will definitely help you out for a post knee replacement plan. But I would suggest you to just go through this video. A disclaimer is that you go through the video, but a personalized care is very essential, because every patient may have a different problem. Even so, the it has to be patient centered, and more of a patient centered customized approach has to be taken. You can go through this videos, you can understand them, you can know about different exercises which are being done. But yes, whenever you are having a knee replacement surgery, see to it that post surgery you need to contact the occupational therapist or physical rehabilitation and or physiotherapist. Post operative care is very much essential, as it has to be personalized considering all the factors. So it's a good question, and I'll definitely look into it and put some videos for that. I have done one video, but that is for exercises for the knees. It can be done pre-operatively, but yes, a personalized thing I will try to make it. Any more questions, please? Before I wind up, it's 4 minutes. We still have. You can ask more questions. If any one of you have got a knee replacement surgery, please mention on the chat box and which knee, and please mention your location. Everyone, please put your location also, so that we come to know exactly from where you were calling, or you are chatting. So you can put your locations, like say for example, if you are from United States, you can put as USA. If you are from Mumbai, Maharashtra, or Delhi, you can put accordingly. Please put your location. I myself am from Mumbai, so I'm putting my location over here, so that similarly you can put your locations, so that we get a feedback exactly from where our entire thing from Kolkata. Okay, so one is from Mumbai, other from Kolkata. That's good. I would like to know where exactly from Assal Malwani itself is. Okay, Bangalore. Okay, that's good. So it's Gautam from Bangalore, Payal from Kolkata, myself from Mumbai. That's good. From different parts of the country. Okay, Asal Malwani is from Mumbai. That's good. And Julie is from United States. Oh wow! So I think my video is also being watched in USA. It's getting good views from USA as well. Thanks, Julie, for being there. It's 10 p.m. right now. I think it's in the morning in USA. That's good. That's good. Absolutely. So we have viewers from Mumbai, Kolkata, Bangalore, and USA. So on this note, I thank you all for being there for me, and in this first YouTube session. In having it was very pleasure to have an interactive session with you people, and I'm glad that you came with lots of questions, and I hope these questions will help others as well. Please forward this video once the live session ends, and thank you all for being there and supporting me. Thank you once again.